Hello everyone, welcome back to Health for You. Today, we're going to explore a very simple yet highly effective natural approach to help improve varicose veins, relieving heaviness, pain, and swelling, supporting better circulation, and making your legs feel lighter and more comfortable. Have you ever felt that your legs become heavy, sore, or tight? Perhaps you occasionally get muscle cramps at night, or when you stand for a long time, your legs feel tired. Maybe you've noticed bluish-purple veins bulging under your skin slightly, especially on your calves or around your ankles. These signs may indicate varicose veins, a common issue, but often misunderstood when it comes to proper home care solutions. In this video, you will learn 2 external application formulas that you can easily make at home using simple, low-cost ingredients. These can bring noticeable improvements if used consistently. First, we'll explain why varicose veins happen, when you should see a doctor, and how to combine natural care with a healthy lifestyle for the best results. Varicose veins, mechanism, symptoms, and when to see a doctor. 1. Why varicose veins happen. In the venous system of the legs, there are tiny one-way valves that help push blood from the legs up to the heart and prevent backflow. When these valves weaken or get damaged, blood can pool in the legs, increasing pressure inside veins. Over time, the veins may stretch, bulge, twist, or become more visible beneath the skin. The walls of veins may also lose their elasticity or weaken due to inflammation, aging, sustained pressure from prolonged standing or sitting, excess weight, hormonal changes, and other lifestyle factors. Genetic predisposition, hormonal shifts, such as pregnancy, sedentary lifestyle, or occupations requiring long hours of standing can increase the risk of developing or worsening varicose veins. 2. Common symptoms. A feeling of heaviness, fatigue, or soreness in the legs, especially after long periods of standing or walking. Bluish or purplish veins that appear visibly below the skin, sometimes twisted or slightly raised. Mild swelling around ankles or calves, soreness or tightness, occasional muscle cramps, particularly at night, sometimes itching or mild changes in skin tone near the affected veins. Skin may become drier or slightly discolored. In more serious cases, noticeable swelling, pain, skin ulcers, or discoloration may appear, indicating the need for medical care. 3. When to see a vascular specialist. If heaviness, swelling, or pain in the legs does not improve after rest, leg elevation, or wearing supportive compression stockings. If you observe significant bulging veins, discoloration of the skin, itching, ulceration, or pain that persists. If you have underlying conditions such as high blood pressure, diabetes, obesity, or a strong family history of varicose veins, you may benefit from diagnostic imaging, e.g. Doppler ultrasound, and specialized interventions to determine whether conservative home care is enough or whether more advanced treatment is required. 2. Formula 1. Onion, garlic, honey, butter blend. 1. Ingredients needed: 1 quart 2 medium red onion or regular onion if red onion is unavailable, fresh and firm. 4 to 5 fresh garlic cloves, peeled. 1 tablespoon TDBSP of pure honey, preferably raw honey, unprocessed, without added sugar. 50 draws of butter. Choose unsalted or lightly salted butter or high-quality alternative of good quality. A clean glass jar with a tight lid. Plastic wrap, cling film, clean towel, light compression socks or support stockings. Optional, recommended after applying the mixture. 2. How to prepare the mixture: roast or bake the onion. Cut or half it if needed, then roast on low heat or in an oven or using a stovetop until the onion is soft and slightly browned at the edges. This helps release the juices. Squeeze or press the roasted onion to extract the onion juice. Strain if necessary to remove pulp. Crush or finely chop the garlic, then press or squeeze to extract the garlic juice. Strain to remove pulp so you keep the juice. In the glass jar, mix the onion juice plus garlic juice plus honey thoroughly. Melt the butter gently, preferably by double boiler, low heat to avoid burning. Pour the melted butter into the jar and mix well. Close the lid tightly, let the mixture cool. If not used immediately, store it in the refrigerator. The mixture may be kept up to about 5 days under proper refrigeration. 3. How to use it on the skin cleanse. The legs, especially the affected areas, gently with warm water and mild soap. Pat dry. Apply a sufficient amount of the mixture to the areas where varicose veins are visible or where you feel heaviness or tightness. Massage gently using circular motions or upward strokes toward the heart to help absorption and stimulate circulation. After applying, wrap the area with plastic wrap so that the mixture stays in contact with your skin and retains warmth. Then wrap an additional towel or cloth over the plastic wrap for extra insulation and to prevent too rapid moisture loss. Let it stay on the skin for approximately 3 hours. If comfortable, you may leave it on longer. After the time is up, wash off with warm water, pat dry. Put on light supportive socks, compression if available, to help blood flow from the feet and legs back up toward the heart and reduce pooling. Use daily until you notice a significant reduction in leg heaviness, pain, or visible bulging. Once improvement is maintained, you may reduce the frequency, e.g. 3 to 4 times per week for maintenance. 4. Why this mixture helps support. Varicose vein relief onion and garlic contain bioactive compounds with anti-inflammatory and mild vasodilatory effects, which may help relieve mild congestion, reduce pressure inside superficial veins, and improve local circulation. Garlic may also help reduce risk of small clot formation and support vascular health. Honey helps the mixture adhere to the skin, retains moisture, and may provide mild anti-inflammatory benefits. Butter acts as a carrier medium, facilitating absorption of the active compounds while also helping to moisturize the skin and reduce discomfort from dryness. Wrapping with plastic film then towel helps maintain warmth, increases absorption, and reduces evaporative loss, enhancing the mixture's effect. 3. Formula 2. Rosemary and bay leaf infused olive oil. 1. Ingredients needed: fresh rosemary leaves, or good quality rosemary essential oil if fresh leaves are unavailable. Dried bay leaves, clean, food grade, without mold. 100 ml of extra virgin olive oil, cold pressed if possible, clean and pure. A clean glass jar with a tight lid. A pot for water bath, double boiler, and cloth to wrap the jar. Fine mesh strainer or fine cloth for filtering. 2. How to infuse. Prepare the oil place. Rosemary leaves and bay leaves inside the glass jar in sufficient quantity so that when you pour oil, the leaves are fully submerged. Pour the olive oil into the jar until all leaves are covered. Gently stir to remove air bubbles, if present. Place the jar into a pot of warm water bath, so that heat is gently transferred. Ensure water level remains below the lid and maintain gentle heating. Avoid boiling the oil or overheating. Keep the jar in warm water for about 30 minutes, allowing the heat to help release active compounds from the herbs into the oil. After heating, allow the jar to cool, then seal it tightly. Store the jar in a cool, shaded place for about 10 days to further allow the herbs to infuse their beneficial components into the oil. After the infusion period, strain the oil using a fine cloth or strainer. Remove the leaves and collect the clear infused oil. Store the infused oil in a clean, airtight container. Keep away from direct sunlight and excessive heat. Properly stored, this oil may last up to 1 year. 3. How to use the infused oil on the skin. Clean the skin area to be treated with warm water, then gently dry. Apply a moderate amount of the infused oil to areas where varicose veins are visible, or where you feel tightness or soreness. Gently massage upwards toward the heart to encourage blood and lymph circulation. Use the oil daily, ideally at night before bed or during periods of rest, so the oil remains longer on the skin, helping absorption and relieving discomfort. You may also apply the oil to mildly sore joints, knees, ankles, elbows, feet, etc., if needed, as the circulation-boosting, mild anti-inflammatory nature may help relieve discomfort. When improvement is noticeable, you can adjust to less frequent use, several times per week, to maintain benefits. 4. Supportive benefits of the infused oil. Rosemary contains powerful antioxidants and anti-inflammatory compounds, which help protect vascular tissue, reduce oxidative damage, and enhance tissue resilience. Bay leaf contains natural compounds that may support circulation and reduce mild inflammation. Olive oil is an excellent carrier medium that aids absorption, retains moisture, and supports skin health. Massage improves local blood and lymph flow, helping reduce the feeling of heaviness, swelling, and discomfort. With consistent use and lifestyle support, the oil may help reduce the visibility of veins, relieve mild symptoms, and contribute to lighter, more comfortable legs. IV. Supporting habits for better results. Consistency matters. Natural remedies take time. It's common to feel some improvement after a few days, but more significant change often appears after several weeks of continuous use. Lifestyle and movement, regular walking, leg-elevating rest periods, gentle leg stretches, avoiding long durations of sitting or standing still help blood circulation. Compression support. Using light compression stockings or supportive socks can dramatically enhance blood return from the legs, reduce swelling and discomfort. Nutrition and hydration. Eat more fresh vegetables, fruits rich in antioxidants and flavonoids. Reduce excess salt, unhealthy fats, and maintain healthy body weight to lower pressure on leg veins. Optimal timing. Using the remedies before bed or after long-standing walking sessions can maximize relief benefits and help overnight recovery. Monitor progress. Keep notes or photos of leg condition and how you feel over time. If you notice visible improvement, continue. If no change or worsening, consider medical evaluation. Recognize limitations. Home remedies support, but may not fully reverse severe structural issues. If your condition is advanced or associated with other health problems, professional medical treatment may be necessary. V. Final message. These two formulas are valuable home supportive solutions for those seeking natural relief from mild to moderate varicose vein symptoms. They are low cost, simple, and can be prepared at home. They do not promise immediate or full cure, but they can significantly relieve heaviness, soreness, swelling, and the visibility of veins when used regularly and correctly. Combining these remedies with movement, compression socks, proper diet, and rest leads to the best outcomes. If your symptoms persist or worsen, or if you have additional health conditions, please consult a vascular or medical specialist for appropriate diagnosis and treatment options. We hope your legs will feel lighter, more comfortable, less sore, and that you will notice real changes with consistent application over time. LIЄN H謡 Vịnh I TOI